Good morning, everyone. Welcome to Unacademy, where you can crack all NEET PG exams with us, with our top educators, quality content, and have a great learning experience. So, guys, let's crack NEET PG together. A little about me. I'm Dr. Sasha Menon Remedies. I've done my MBBS from Father Muller Medical College, Mangalore, my MD in Anesthesia from Father Muller Medical College, Mangalore. I have 2 publications and 1 paper presentation in the field of anesthesia, and I've been working and teaching in Bangalore for the past 2.5 years. Today's topic will be anesthesia breathing system. I'll be covering it in 2 parts. First part is I'll be dealing with now. The second part, we will deal with it at 1:20 p.m. So a little about Unacademy. It's one of India's largest online learning platform where you can get plus subscription and access to unlimited live and recorded courses, and all these from India's best educators. So what will you get out of Unacademy? Basically, we have our daily life classes. So like I said, daily life classes in the sense these are daily life classes from the point of view that when you go to a coaching institute, you have to get up in the morning, you have to take the effort, you have to make an effort. It takes time, it takes energy, and there are a lot of other issues to it too, right? But here at Unacademy, so it takes time, it takes a lot of effort. You have to get up, get ready. Then once you reach there, you have to get an appropriate place to sit down. Then your educator has to be able to clear everyone's doubts, which is all very difficult because it's all a stipulated amount of time. The next educator will come in at a particular time. So here at Unacademy, you can chat with your educator, engage in discussions, clear your doubts and answer polls, and all this is while the class is going on. So now these are all structured courses. So they all are structured, they are in line, the educators have researched, and whatever is required for you all from syllabus point of view, based on that the courses are prepared. Then we have our live tests and quizzes, so which will help us evaluate. So we have live tests and quizzes. These help us evaluate your preparation, which help you all rather evaluate your preparation. So after classes we conduct some tests and quizzes, and based on that you all can evaluate how well you all are doing and get a detailed analysis on your performance. Yes, so one subscription gives you access to all our live and recorded courses, and you can watch from the comfort of any of your devices. These are some of our top educators. Dr. Nikita Nanwani. She's a NEET PG mentor for radiology as well as mnemonics and concept, focusing on must-know topics which encompass all subjects. Dr. Mohammad Azam, Dr. Divish Mishra, Dr. Sharma. Now these are some of our courses offered. So as you can see on the screen, there are various uh, there are various uh, uh, what do you call it, there are various subjects that you all have to cover. These subjects are not easy subjects, but still you all have to do it. So from that point of view, it's very tiring, I know, for you all, but you all have to do it. So like subjects like anesthesia, radiology, psychiatry, dermatology, you all didn't really have to go into much detail during MBBS, right? But over here you all need to know a little bit in detail because it is not so easy. So you all have to know a little in detail so that you all will be able to answer the questions. But however, mostly these questions are, again, since you all didn't have to go in detail, even over here exam point of view, the questions will not be that much in detail, but these are questions that you cannot answer without going through and revising the subject or listening, reading, study material. Now 11 marks are awarded to these subjects, whereas your other subjects like physiology, anatomy, pharmacology, 44 marks have been allotted each, so they can ask you anything from anywhere from these subjects. So these are some of our ongoing courses in our platform. A course on neurophysiology, GI surgery, cardiovascular thoracic surgery, a course on the capsule of the larynx, respiratory system, Coming to the subscription point of view, as you can see, there are 5 types of subscription. As you can see, there are 5 types of subscription. Those of you who are giving the exam this year, 6 months subscription should be enough. For the rest of you, I would recommend the 12 and 24 months. These are good subscriptions. They are economical. For those of you who want to drop a year, it's ideal. There is nothing wrong in dropping a year. I dropped a year. It has its benefits, and of course, there are side effects too, but it does have its benefits. There's nothing wrong. Mostly, no one will ask you how long you took to clear your NEET PG or how long you took to clear PG. Also, nobody really cares. At the end of the day, it is practice, and it is practice of what you are going to enjoy. Now coming to this more economical, because it's a one-time subscription, so after 6 months again you will have to subscribe. But as you can see, this 12 month you have the buffer period, so it is fine. So 12 and 24 months, as you can see, use my code. And also another positive point is that you have time to really understand what you want to do, what subjects you enjoy, what you need to go through. So it actually does help you all prepare. This, after all, this is what you all will be doing for life and what you all will need to enjoy. So use my code SASHA and avail a 10% discount. Here is the discounted prices. The discount applies on all the subscriptions. 24 months, again, 24 months, again you can avail the 10% discount using my code SASHA, 10% discount, and we'll see. So coming to the topic now. So earlier circuits were simple. The difference was only in the type of anesthetic agent administered. The purpose of breathing systems that have involved in anesthesia practice is to deliver gas and vapor to a patient in an appropriate, controlled, and efficient manner. So this is the primary outcome that is desired by us. Now, a breathing system is basically defined as an assembly. So the breathing system is basically defined as an assembly of components which connects the patient's airway to the anesthetic machine, creating an artificial atmosphere from and into which the patient breathes. So breathing system, it connects the patient's airway to the anesthetic machine, creating an artificial atmosphere from and into which the patient breathes. So it is an assembly. It connects the airway from the anesthesia machine to the anesthesia machine and creates an artificial atmosphere from and into which the patient breathes. So it converts a continuous flow from the anesthesia machine to an intermittent flow. So it converts a continuous flow from the anesthesia machine into an intermittent flow. In practice, the breathing system is usually regarded as extending from the point of fresh gas So in practice, the breathing system is regarded as so the breathing system is usually regarded as extending from the point of fresh gas inlet, the point at which gases escape the atmosphere, or a scavenging system. So basically from the point leaving the anesthesia machine to the point where it comes back. Rebreathing in an anesthesia system is now conventionally refers to breathing again of some or all the previously exhaled gases, including carbon dioxide and water. Right? So this occurs usually in spontaneous breathing. It can occur if there is any fault with the anesthesia circuit during controlled medication. So the components of a breathing system. Um, so formerly these were called the breathing apparatus or breathing circuits, but these names have been abandoned. Now it is known as the breathing system. The components are, it consists of a fresh gas entry port, delivery tube through which the gases are delivered from the machine to the system, a port to connect it to the patient's airway, a reservoir bag for gas in the form of a bag or a tube to meet the peak expiratory flow requirements, an expiratory port valve through which the expired gas is vented to the atmosphere, tubes for connecting these components, flow directing valves may or may not be used, and a carbon dioxide absorber total rebreathing is, if rebreathing is to be allowed. So connector wise, a connector is a fitting that joins together two or more similar components. Okay, so one component will get fitted here and one component get fitted here. So it joins together two or more similar components. An adapter is a specialized connector that establishes functional continuity between otherwise disapparato incompatible components. So an adapter connector fits two or more similar components, whereas an adapter, uh, so basically for a, this is an adapter. Okay. As you can see, the diamond, what will fit here and what will fit here, definitely the dimensions will be different. So it is a specialized connector that establishes functional continuity between two dissimilar components. The sizes are universal and are either male or female, that is 15 or 22 connections. Some incorporate gas sampling ports, right? So all face masks have a 22 So all face masks have 22 female opening. While other devices have a 15 male fitting. So to facilitate the change from mask to tracheal tube and a component and the like, a component having a 22 male fitting with a concentric 15 male fitting is issued at the patient connection port. So a 22 male plus 15 female. So these are the combinations that are generally issued. So in selecting a connector, so now the uses of connectors and adapters. So it extends distance between patient and breathing system. So it extends distance between patient and breathing system. This is especially important, in head and neck surgeries, where the presence of the breathing system near the head end may make it difficult for the surgeon and the anesthetist. Change the angle of connection between the patient. It changes angle of connection. Changes angle of connection between the patient and the breathing system. Allows more flexible allows a more flexible connection. It allows a more flexible and less kinkable connection between the patient and breathing system, and it increases dead space. Okay, these are the uses. Then the principles that need to be kept in mind. This is not a use, okay? This is a disadvantage. Increasing dead space is a disadvantage, right? Principles that need to be kept in mind are: resistance increases with sharp curves and rough sidewalls. So there will be increase in resistance. Dead space, this should actually come here. And the location. So the locations at which, so the more number of connectors are present, the more number of dislocations. So more number of areas where locations at which dislocation can occur. Now, bacterial filters. So they prevent transmission of infection to the patient or contamination of the equipment. So one end is connected to the machine, one end to the patient. So this is your filter. So it protects the machine as well as the patient. A new filter should be used for every patient, or in the absence of filter, a disposable system should be used on every patient. This is mandatory to maintain hygiene. So these are the filters. So this is the filter basically. This is the HME filter unit. So this is the patient circuit. This is cool and dry fresh gases in and from the machine. HME unit collects heat and moisture exchange, and warm moist gases going to the patient and coming from the patient. So basically it warms the gases. This is your capnography monitoring. So filters are basically used to protect the patient from microorganisms and airborne particulate matter, and to protect anesthesia equipment from the environment from exhaled contaminants. So it also protection from contaminants. It increases humidity, humidifies the gases. So it humidifies and warms the anesthetic gases delivered to the patient. And it prevents exposure to latex allergy. So basically the anesthesiologist, surgeon, everyone wears latex gloves. So these allergens can enter the patient, right? Because they are constantly touching the patient. So this prevents exposure to latex allergens. There is no basic recommendation. These devices also help to humidify the gases that are being sampled for analysis by side stream devices. So the gases that are sampled here, and humidifies those too. There is no recommendation. There is no basic recommendation where to place the filter in the breathing system. I mean, there is no recommendation that the filter has to be placed in the breathing system unless the patient has an infectious disease. It is recommended that either a filter be placed between the patient and the breathing system, with a new filter used for every patient, or a discardable system be used. in pediatric patients, it can increase resistance and can cause inefficiency, and it causes inefficiency of the system, right? Then we have types. So the types of filters are, mechanical filters. So mechanical filters, they are hydrophobic. They utilize some compact fiber material that is pleated to increase the surface area. So they will have some material inside that is pleated to increase the surface area. They are very small pores and act by physically preventing microparticles from passing. This is what is generally used, mechanical filter. So within the filter, they have like you can see. So this within this will be some pleated. As you can see the folds here, so it will be pleated surface which increases the surface area, and they have small holes which physically prevent microorganisms and particles from passing. Then we have, so first is our mechanical filters. Then we have our electronic filters. Okay, so electronic filters uh, use a felt-like material that is polarized in an electromagnetic field. Okay, they rely on electrostatic forces to hold. So basically, they have some material that is electrostatically activated in an electromagnetic field. So basically, by electrostatic forces, they hold the organism within a loosely woven filter element, right? The fibers are less dense, so they are less closely placed than a mechanical filter and less satisfactory than the mechanical filter. So it is not so satisfactory the way it is built. So based on electromagnetic forces, it holds the organism loosely. Okay. Then filtration efficiency. So a highly efficient filter should trap at least 99.97. So this, to maintain high efficiency, should trap at least 99.97% of particles having a diameter of 0.3 micrometer, right? So it should trap 99.97% of particles which have this diameter. Therefore, when a filter efficiency has to be stated, the size of the challenge particle or organism should be disclosed. So on the manufacturing details, they need to disclose what size of particle can the filter uh, prevent from, bind to. The approximate size of HIV, so HIV virus is 0.08 micron, and HCV is 0.6. Your TB is 0.3, exactly that, and Pseudomonas 0.5, and Staph Pseudomonas yeah. These are the diameters of various organisms. So the filter location in the breathing system, it can be attached to a disposable breathing tube. It can be attached to the ventilator hose as a separate component. So filter placed at patient port may permit disposable breathing systems to be reused. So if it is placed near the patient, the breathing this can be reused, because whatever is coming from the patient is first being filtered and then entering to the anesthesia machine. So these anesthesia tubings can be reused, right? A filter should be placed downstream of a humidifier or a nebulizer, because it may become less efficient when wet. So if a nebulizer is being used, The nebulizer should be, if the patient is here, nebulizer should be placed here followed by the filter, because otherwise it can become wet and the efficiency might come down. And also there may be an increase in resistance to nebulization, and that can be hazardous. Then disadvantages of this filter, basically problems associated with the HME filter. So one is resistance and dead space, which will increase. So resistance and dead space will increase. Significant rebreathing can occur. Okay. Then if it gets clogged, if the filter gets obstructed, right, it with blood or fluid or any nebulizer drug, it can be very dangerous to the patient, as the back pressure will increase, the peak inspiratory pressure will increase. Okay, and any leaks and defects, it can be hazardous, right? Disconnections too, leaks, defects and disconnections. So now coming to the reservoir bags. So it is made up of rubber, synthetic latex or neoprene. Yeah, so reservoir bags, they are, so most breathing system have a reservoir bag, also known as the respiratory bag. It is made of rubber, plastic and ellipsoidal in shape, so then they can be, so the shape is ellipsoidal. This is so that they can be grasped easily. Okay, they are available in various sizes ranging from 0.25 to 6 liter. So they available in various sizes from 0.25 to 6 liter. Okay, so the neck should have a 22 mm female connector. This is the neck, this is the tail. A loop may be provided near the tail to hold the bag upside down, which facilitates drying. So usually there will be one little loop over here. This is to hang the bag during drying, right? So after washing, it can be reused again. The bags, so there are closed end, double end or Kunz bag. So normal size adult bag, sorry, yeah. So normal sized adult bag holds a volume exceeding the patient's inspiratory capacity. So it holds a volume that exceeds the patient's inspiratory capacity. So the functions are, basically the bag has the following function. It allows gases to accumulate during, so it forms a reservoir. Basically it allows gases to accumulate during exhalation. This provides a reservoir of gas for the next inspiration. So it forms a reservoir and allows more economical use of gases and prevents air dilution. Then it provides a mean Weber ventilation can be assisted or controlled. Okay, ventilation can be assisted or controlled by, so this is the loop which after washing the bag can be hung. So it provides a means where ventilation can be assisted or controlled. It protects patient from excessive pressure in the breathing system, and it serves through visual and tactile observation as monitors. So it can serve through visual and tactile observation as a monitor. So as the bag fills and deflates, it is a visual representation of the patient's breathing. And even when you hold the bag in the hand, you can feel the movement of the bag. This represents a tactile observation of the patient spontaneously breathing. So it also protects the patient from excessive pressure in the breathing system. So there will be an APL valve which one can feel the pressure. So the ASTM standards, the bags of 1.5 liter, for bags of less than 1.5 liter, the pressure shall not exceed 30 centimeters, and maximum pressure, the minimum pressure shall not be, sorry, the minimum pressure shall be 30 centimeter water and shall not exceed 50 centimeter water. This is bags of 1.5 liter or less. For bags more than 1.5 liter, the minimum pressure more than 35 and maximum of 60. So 35 to, sorry, 35 to 60, and here this is 30 to 30 to 50. Latex-free reservoir bags may allow high pressure to develop. So the increasing compliance and elasticity of breathing bags as described by three phases of filling. Now, bags are available in variety of sizes as we saw. So a 3-liter bag is traditional for use in adults. We generally use a 2-liter bag. A small bag, on the other hand, provides less safety with respect to pressure fluctuations. You cannot appreciate pressure fluctuations too well in smaller bags, and the fluctuations may not provide large enough reservoir by the volume. Now coming to breathing tubes. So they are large bore corrugated. Just a sec. So breathing tubes composed of, these are large bore and corrugated, uh, flexible, low resistance and lightweight. Large bore corrugated, they should be they are flexible, low resistance, low resistance and lightweight. So corrugation will increase the flexibility. So this corrugation increases flexibility and prevents kinking. Okay, so it increases flexibility and prevents kinking. Breathing tubes have some distensibility, but not that much distensibility to prevent from pressure hazards. Small diameter breathing tubes are available for circle system for pediatric patients. So the adult, the internal diameter is 22 mm, and pediatrics it is 15 mm. A tube holder is used to support the breathing tubes and prevent them from exerting a pull on the breathing devices. Correct? So the length is variable. It can be impregnated with silver to add antimicrobial effect. Internal volume is 400 to 500 ml per meter, and distensibility is 0.5 ml per meter per mm of mercury. The internal volume is around 400 to 500 ml per meter, and distensibility is 0 to 5 ml per meter per millimeter of mercury. So it resistance to the resistance to gas flow is less than 1 millimeter of water per liter per minute of flow. Corrugations prevent kinking and increase flexibility. So resistance is less than 1 millimeter of water. Backflash seen during spontaneous breathing. There will be backlash is basically you will see condensations on the tube during spontaneous breathing. Uh, Wasted ventilation is seen during controlled breathing. Now the functions, it acts as a reservoir in certain systems, and they provide connections from one part of the system to another. Now they are also called as expiratory valve, hide brink valve, dump valve, exhaust valve, spill valve, um, pressure relief or pop-off valve. Okay, so it is a user adjustable valve. So it is basically a user adjustable valve that releases gases to a scavenging that releases gases to a scavenging system. It is used to control the pressure in the breathing system. So it is a user adjustable valve that releases gases to the scavenging system, and it is used to control pressure in the breathing system. Okay, then so it basically it is used. Sorry, I think there is some connection issue. It is a user adjustable valve that releases gases to the scavenging system, and it is used to control pressure in the breathing system. The construction, the control part serves to control the pressure at which the valve opens. So it consists of basically the most commonly the spring loaded disc is the most common type used. Okay, it is the most common type used. It has three ports: an inlet port, a patient port, and an exhaust port. Right? So a threaded screw cap over the spring allows the pressure. So this is a threaded. This is the screw cap. This is the threading. So a threaded screw cap over the spring. This is a spring. Sorry, not the. So the screw cap over the spring allows the pressure exerted by the spring on the disc. So this screw cap allows the pressure of the spring along upon the disc to be vary. When the cap is fully tightened, the disc. So when the cap is fully tightened, the disc will prevent any gas from escaping from the system. So this is connected to the system. These are the screws that bind this apparatus over here within this, and this is of course the connector. So exhaust port may be open to atmosphere or the scavenging system. So this is the exhaust port. It may be open to the atmosphere or scavenging system. As the cap is loosened, so when this screw cap is loosened, the spring tension is reduced on the disc and it can rise. So when the pressure in the breathing system increases, basically when the pressure in the breathing system increases, it exerts an upward force on this disc. When this force exceeds, so when the pressure inside increases, it exerts an upward force on the disc. When the upward force on the disc exceeds the downward force by the spring, the disc rises and gas flows out through the valve. Again, when the pressure in the system falls, the disc returns to its seat. So when the cap is at its maximum open position, there will be only minimal pressure exerted by the spring on the disc. So the weight and pressure on the disc ensure that the reservoir bag fills before the disc rises. So the weight and pressure by this. So one side will be the reservoir bag, one side will be the patient connection. So one will go to the patient and one side will be your reservoir bag. So first the reservoir bag fills and then only the pressure builds up on this, right? Uh, so the stem and seat type. So in the stem and the seat type, um, so a thread stem allows variable contact. So a thread stem allows variable contact with the seat. As the valve is opened, the opening at the seat becomes larger and more. So as the valve is opened, as the disc valve is open, this becomes more free. The opening at the seat becomes larger and more gas is allowed to escape, right, from the patient. This is coming from the patient, this is going to the scavenger. So as the valve is open, the opening at the seat becomes larger and more gas is allowed to escape. Some of these valves have a disc or ball valve in retaining the cage. So in retaining the cage, they have a disc valve or a ball valve. Then comes the control knob type. In this, basically, the APL valves in this will have a rotatory control knob. So valves with basically the ASTM standard says that valves with rotating controls have to be designed so that clockwise Motion increases the limiting pressure. Clockwise motion increases the limiting pressure. This will ultimately close the leading to closure of the valve. Okay, collection devices and exhaust port is basically to remove the excess gas from breathing system. Remove excess gas from the breathing system and to direct to the scavenging port. Okay. The exhaust port, so basically that exhaust port is the aperture through which excess gases are discarded to the scavenging system. The exhaust port should be 19 to 30 mm. Yeah. So uses, this is the Humphrey type valve, APL valve with, these are basically Humphrey type valves are APL valves with inbuilt overpressure safety devices. So they will pop off whenever the these are what is used in the ventilator machines. So they will usually pop off when pressure within the system rises. Now, uses of an APL valve during spontaneous respiration, the valve is kept fully open. Partially closing will result in some form of positive end expiratory pressure, which will keep the airways a little open. So this positive end expiratory pressure just keeps the airway, they prevent the airway from totally collapsing during expiration. So normally within us itself, we have the normal positive end expiratory pressure is 5 centimeter water. So when we exhale, it's not like our airways fully collapse. They are still remain open till they fill again during the next expiration. So pressure is less than 1 centimeter water should be needed to open the valve, and it should have a pressure drop of 1 to 3 centimeter water for airflow of 3 liter per minute, and 1 to 5 centimeter of water at 30 liter per minute. Okay. Now during controlled ventilation, the valve is partially left open. So it is half closed, partially left open. The breathing, okay. If compliance, or during control, if the compliance falls or resistance increases, the valve must be tightened. So the breathing system, so the essential principle and criteria, the breathing system must deliver the gas from the machine to the alveoli in the same concentration as set and in the shortest possible time. It should effectively eliminate carbon dioxide. So basically carbon dioxide that is delivered should be effectively eliminated, right? All the carbon dioxide should be scavenged. Should have the apparatus should have a minimal dead space, and it should have low resistance. Sorry. Yeah. So the secondary criteria is economy, Economy of fresh gas should not be wasted. Conservation of heat, adequate humidification of inspired gases, and it should be lightweight. So the breathing system should be lightweight. It should deliver adequately humidified air gas, humidified the inspired gases, which can be achieved with a humidifier, and it should conserve heat, and should be economical. There should be no minimal wastage of fresh gases. So the convenience during use, efficiency during spontaneous, and as well as it should be efficient during spontaneous as well as controlled ventilation. That is basically determines on the efficiency is determined by the carbon dioxide elimination and fresh gas utilization, right? Adaptability for adults and children and mechanical ventilators. Okay. So the breathing system should be adaptable for use in adults, for use in children, as well as for use in mechanical ventilators, and there should be provision to reduce any theater pollution. Okay. Now, little about this is Humphrey's valve, but a little about positive. This also needs to be discussed. Sorry. Positive PEEP valves. The positive end expiratory pressure valve. These are present on the ventilator. They may be used with spontaneous, can be used with spontaneous or controlled ventilation. Sorry, I wanted to put another empty slide, but I guess I missed that. So, used with spontaneous or controlled ventilation. Um, then it may be unidirectional or bidirectional. So they are usually marked with an arrow, okay? So they are usually marked with an arrow. They are usually marked with an arrow which will indicate the proper direction of gas flow and inlet and outlet. So after a PEEP valve is inserted, the breathing system pressure gauge should be checked to make certain that the peak expiratory pressure is being delivered. A unidirectional, it can be, like I said, unidirectional or bidirectional. Um, then it can be used with the circle system, or it can be used with the circle system too. Now, in a spontaneously breathing patient, if PEEP is used, the work of breathing is increased. Right? If PEEP is used, the work of breathing is increased. Uh, Whereas with controlled ventilation, it is very helpful because when PEEP is used, controlled ventilation, when PEEP is used, the tidal volume can be decreased. So this prevents a lot of harm, because in certain conditions, like especially pulmonary surgeries and all that, when PEEP really needs to be reduced, PEEP needs to be decreased, because in these conditions a lot of PEEP can cause a lot, high PEEP can cause a lot of harm. So in these conditions, PEEP needs to be reduced, and hence in such patients, PEEP is can be disastrous. I mean, PEEP can be very helpful because low tidal volume ventilation is required to prevent damage to the airways, right? So this was about so the breathing systems. They are, I'll just tell you briefly, but we will deal with this in our next class. So they are classified based on the function and based on the, so the classification is based on function and based on equipment, right? So based on function, they are classified in the presence or absence. So based on function, we will deal with each one separately in the next class. But based on function, it is classified as Gibbs, Eckenhoff, and Vandal. Moyer, so based on function, it is classified as Gibbs, Eckenhoff, and Vandal. Moyer. So uh, Gibbs classification, I'm sorry, okay, it's not there. So classification based on function and based on equipment. So based on function, various Drips, Eckenhoff, and Vandal, then Moyer, Colin, Adrian, Conway, uh, McMahon, Barake, and Marini, Culver, and Kirk. So there are a lot of classifications based by the function, whereas based on classification by equipment, it is a description of the equipment and total. Basically, it is a circle system with a 2 liter per minute fresh gas flow. So it is classified based on equipment. This open, semi-open. So in this classification by function system, there was open, semi-open, closed, and all that was discarded, and this was totally based on the circle system. So this classification by equipment was based on the circle system. So guys, that is about it for today, and we will be covering, so we discussed about the various what all is there in the breathing system till we reach the actual breathing system, which is your Mapleson system. We will be dealing with the Mapleson system, not the circle system. So till we reach there, we have seen the classification. There are a lot of components in the breathing system. So we have the various components like the humidifiers. Then we have the APL valve. Then we have the connectors, right? Humidifiers. Then we have the filters. The filters and the humidifiers are same. The PEEP valve. So all these play a role. The bag. So all these basically all these play a role. These are all part of the breathing system that we will be discussing in our upcoming class, right? So guys, don't forget to use my code, like I said, SASHA. So we will start the next class from here. If there is time permits, I will revise the previous class for those of you who could not attend the previous class. So use my code SASHA to avail your 10% discount. Yeah, so when you all subscribe, use my code and you all can avail the 10% discount. So guys, subscribe, and I will see you all shortly at about 1:15 is my next class. So we will discuss the remaining of the breathing system parts in the next class. It will be basically be the Mapleson's classification, Mapleson A, the lax modification of Mapleson A, Mapleson B, Mapleson D, Bain's modification, Mapleson E, Mapleson F. So we'll discuss how the fresh gas flow flows, the advantages, disadvantages, all in the next class. Thanks guys. Do subscribe using my code SASHA and avail your 10% discount.